think what our doctors want is what makes their delivery of care to their patients and our patients as safe and as effective as possible. All of our doctors are motivated to provide the best care they can, and our job's to provide them with the tools to facilitate that. And if we can improve their workflow so that they're not back and forth to the nurse's station, ferreting around in histories, trying to find out where a fax has been filed, but instead just go straight to the patient, have the results in their hand, not only does it speed up their workflow, it makes it less likely that results will be overlooked, and it also aids them in communication with doctors and families because they can actually show them the x-ray from this morning, show them whether their lungs are clearing after their pneumonia, show them that their blood count is improving in response to the antibiotics. And all of this, I think, is very powerful for engaging the patient in their care. About 4 years now, I think probably about just over 2 years ago, Cabrini Health rolled out the PAS as the backbone of our information system across the organisation. Prior to that, we had a number of different systems, including a homegrown one that had provided the backbone of our patient administration system, but probably like many organisations, we also had a number of standalone systems in the emergency department, the theatre, the day oncology, the cath lab, and none of them spoke to each other. So the number one priority was to try and integrate that into one system, which pulled together the billing, the patient location, their demographics, and fundamentally what that gave us was the ability to see at any time where our patients are. So with all of that sitting behind it, it seemed logical that instead of developing a whole new system which essentially needed 80% of the information that was already in the PAS, that if we could piggyback on top of that and just add the functionality of being able to see the clinical results linked to the patient and remove all of the interfaces that we currently, or at that time, had to the different information systems, then that would be a wonderful goal. Prior to this, we did have electronic access to a number of investigations, but each of them involved going into a different software package, entering a patient's name or UR through their search function, pulling up the image or the haematology result, and then when you needed to look at the next patient, repeating the whole process. With our PAS already knowing where our patients were, what their name is, which bed they were in, what their UR is, we felt that if we could use that software to pass the information invisibly through to the laboratory systems and the radiology systems and remove those irksome interfaces in between, that would be a fantastic improvement in the functionality. I think like all software, what we're aiming to do is to make it look really simple, even though I guess as a clinician I understand that there's some complex stuff going on behind there, but our clinicians aren't interested in that. But to be able to stand by a patient's bed, click on their name, and then be able to go straight into what's effectively 3 different information systems at this stage. We have the PAC system for the medical images. We have a separate system which records the radiology reports, and a third system which handles the laboratory medicine. And these are systems that we use because we have arrangements with radiology and pathology providers where we have joint ventures with them. So we utilise their existing systems. It wasn't a question of us having to try and invent the system, it was just a question of trying to link it seamlessly to the system that we already had. The overall goal, I guess long term, is to move towards electronic medical records. We see lots of risk with the current paper-based system, lots of inefficiencies. It's a barrier to good communication to general practitioners and other referrers. Many of our doctors, myself included in private, have abandoned paper records and run our own practice management systems, and we see the advantages of them. But the task for a hospital to implement that is massive compared to an individual practitioner. There are two ways that we could go about this. If we were a public hospital, we might put the process out to tender, choose a provider, and then over a couple of years implement it. We would have a group of doctors who are all employees, and basically it would be their responsibility to learn how to use the system. And we've seen that even when you employ the doctors and you have that management control over them, that it's not an easy task, and at least one of our big public hospitals has seen a number of their doctors rise up in anger at the rollout of a system with a clunky interface in which they saw as slowing down their ability to deliver medicine. So it was clear that to try and go down that path in the private system, and there have been some attempts in the private system elsewhere which have not been greatly successful, we felt that to try and go down that path would be extremely dangerous, high-risk strategy, because while our primary customer is the patient, to a large extent our other group of customers is our doctors, and they choose to come here, they choose to bring their patients here, they choose to base their practices here, and we have to provide them with what they want, not what we want them to have. In discussions with our doctors, it was apparent that the number one priority was to give them the information. So we chose to develop this system incrementally, and starting off by delivering in the simplest possible way the information that doctors wanted, put it into their hands, engage them with the process, hopefully getting them to a point where they not only wanted to use this software, but they were wanting more. And then we would gradually build on that with other functionality in the future, hopefully, such as discharge summaries, medication, e-prescribing, but that we would start off by absolutely giving them what they wanted and what made their lives easier and what made the delivery of care for their patients safer, and that was radiology and laboratory medicine in their hands.